We're not going to talk a whole lot about treatment in this video. That's for another one. We're going to touch on it a little bit. Treatment for borderline personality disorder is a focus on psychotherapy, a focus on talk therapy with possible adjunctive medication. So possible medicine to help. So therapy first, one, medication if needed. That's BPD. Bipolar is different. Medication first, therapy if needed. These are important things to remember if you have these diagnoses. Borderline, therapy first, medication maybe. Bipolar, medication yes, needed. Therapy maybe, depending on who you are and what you have to deal with. But that is important because there is no specific medication to treat borderline personality disorder. There are medications that can treat some of the symptoms, but there are specific medications to treat the major symptoms of bipolar disorder. Talking about medication specifically, and we're only going to go into this a little bit, and remember, I am not a medical doctor. We are not going to talk about every medication. We're not going to talk about side effects. We're going to just touch a little bit on what you might hear about. For borderline personality disorder, medication is the second line of defense. What's the first line of defense? Therapy. For borderline personality disorder, the first line of defense is therapy. The second line of defense could be medication, and that can include things like antidepressants, antipsychotics, and mood stabilizers. For bipolar, the first line of defense is medication. For bipolar, the first line of defense is medication, and that includes things like mood stabilizers, antipsychotics, antidepressants, anti-anxiety drugs. You can use anti-anxiety for borderline personality disorder too. That's up to your psychiatrist and you.